I tried to find the most pompous sounding title so that if nothing else, you'd think, he must be smart. Basically what we're looking at is whether or not being in a speech class helps people. And how we can test that. Well, let's take a look at how this came to be. The background. What I'm sharing with you today actually is some insights into classroom research directed toward answering that question, are we making a difference? The background on that, as you probably know, SACS does require that we do assessments of our general education courses. In some of those areas, we have field exams that kind of give us that insight. Speech is not that way. So in 2004, as we were gearing up for the last SACS reaffirmation, we adopted an oral communication rubric and established some means of trying to determine whether or not speech class was doing what a speech class needed to do. And some of you have been involved in the process. The rubric is great. There's nothing wrong with this information. As a matter of fact, these are the different skills and so forth that we try to impart in the speech class. One section is about their planning and their content, and then the actual delivery, and then an overall assessment. And I've got copies of this if you'd like, but the assessment protocol revolved around having 2 faculty members who were not associated with communication come into the class and use this rubric to grade at least 10% of the students in the class. And usually we have 120 to 140 students per semester. So it was determined along the way that if we could have 2 outside faculty members, and I see some familiar faces who've been part of that project, and some of you know exactly what I'm talking about. You come in and use this rubric and grade the students. And that's great. It's a good rubric. I have some problems though with the whole process. There are weaknesses in that assessment method. First, there was no real assurance that we could get a representative sample of the students taking the class. And we would determine what days of the semester a certain speech assignment was going to take place. And then either Judy Walton or Karen Austin would go through faculty schedules and try to find 2 faculty members who were available during those days and times. And then they would set all that up. The faculty members would come in and use that rubric, and it was just a crapshoot as to which students were giving speeches on that day. And some days I would go, oh, thank you, Lord, these are my 10 best students. And other days I would go, oh, crap. This kid's barely passing. So you understand how that could be a problem. So there was no assurance that we were getting even a fair sampling. And then there was this whole issue of we had faculty members with no background in doing this kind of assessment, and time constraints being what they were, we just didn't really have a lot of time to do any kind of training on, well, by the way, here's what you're supposed to be looking for. And so we would have sets of evaluations that didn't agree. So there were issues with that. And then, this was just a snapshot. You know, there was no way of saying, was this student worse at the beginning of the semester than they are now? We didn't know. You know, nothing in the data was really useful, and frankly, this means of assessing the class was just checking the box to say, yes, Southern Association of Colleges and Schools, we indeed are looking at what we're doing. Well, this past semester, I wanted to take a different approach and just look at this question. Does the speech class make a difference? Are we making a difference in the lives of our students by what we're doing? Obviously, in the class, students are going to learn the content. And in a performance-based class, they build some skills. I don't know how much you're familiar with assessment ideas, but SACS does not allow us to base any kind of insights into grades. You know, the fact that the student passed the course, yay, rah, SACS doesn't accept that. Now, I take exception in the speech class because they can't pass the class if they haven't built the skills and learned the content. But on top of that, what my new approach does is gauge to what degree the student is gaining confidence. We'll talk about that in a moment with some assumptions that I have about what we're doing. But let's get back to the title. There are a couple of operative terms that I want to take a moment and look at. Operative terms being immersion therapy and public speaking anxiety. Take the second one first. Public speaking anxiety. You've probably been there. Most of us have. Public speaking anxiety, also known as speech anxiety or stage fright. And basically what we're talking about is a fear of public scrutiny of a presentation. Are they going to think I'm stupid? Are they going to laugh at my jokes? Are they going to laugh at me when I don't intend for them to laugh at me? This is usually accompanied by a whole realm of physiological symptoms, the sweaty palms, the knocking knees, the quavering voice. And my heart goes out to my students every semester when I see those who start a speech and then have little splotches of red that usually start right about here. And by the time the speech is ended, their ears are bright red with splotches of red on their cheeks. They don't realize it, but it's a physiological symptom of being just scared to death. I have great empathy for my students. The other term is, and I'm so a little bit intimidated by the fact that we have the psychology department here. Because this is a psychological term, immersion therapy. Now you don't have to be underwater, okay? That's not the immersion part. But I love the picture. Immersion therapy is a psychological term, and the history of this has also been known as flooding. The current term actually is exposure therapy, and there's been some history on this and some disagreement about whether or not it needs to be the kind of slow process where people learn relaxation techniques in the process. Some of the more recent research in this field seems to indicate that learning relaxation along with the exposure to whatever it is isn't really all that important. Although I don't want anybody just to kick me off the dock to see if I can swim. The whole idea is to treat fears or phobias. I don't want to jump into a pit of rattlesnakes either, so that kind of immersion therapy doesn't do it for me. But a layman's definition, doing the thing you fear in an effort to control your fear. And that's really what a speech class does. Now, some assumptions. My assumption is that the Intro to Speech course is a form of immersion therapy. Like I said, I have great empathy for my students. I approach the class as if everybody is afraid of being there. I asked the question on the first day of class, show of hands, how many of you would have taken this class if it were not required? Your son did not raise his hand. Yeah. In a class of 20, I might get one. And that's the one I'm afraid of. But immersion therapy, as we control our fears, we reduce anxiety, If you reduce anxiety, you increase confidence. And the payoff for all of us is that increased confidence as a public speaker makes the student more marketable in the whole job market. 2 applicants go for a job, equally well qualified, same GPA, same school. The one that can express their great ideas will be the one that gets the job. So, putting the assumptions to the test, does the class reduce public speaking anxiety? How in the world can we test that? Well, we brought about a new protocol that involves a pre-test, post-test. Biggest weakness of the old way, the snapshot, didn't tell us anything. So a pre-test to determine at the beginning of the semester what is your state of being as far as your anxiety, and then a post-test at the end of the semester. There happens to be something called a personal report of public speaking anxiety. This is a 34-item Likert scale survey that has been around for about 40 years. James McCroskey is a name that you probably have not heard. He's a communication theorist. But McCroskey is sort of the guru in the realm of communication theory for all of the various realms of communication anxiety, communication apprehension. And he developed the PERPSA, the Personal Report of Public Speaking Anxiety. Well documented, dependability is above 90%. And I didn't have to reinvent the wheel. Now, I've got several copies. I'm not going to give them to you, though. One of the things that we tell our students in the speech class is don't give handouts during the speech, because you'd be looking at them. I want you to listen to me. And I'm not really finished, but that's okay. Is my time up?
1 minute.
1 minute, okay. Well, here's the results. Pre-test, this is in the low range. There are 3 ranges on the anxiety report. And I was really delighted. At the beginning of the semester, over half of the students rated in the low area. Post-test, it had gone up to 75%. And the ranges, pre-test, mean 9208. The lower it goes, the less anxiety. The post-test mean was 81. 83% had lower anxiety scores, but 54.7 had scores 10 points or more lower than the pre-test. I was delighted. So, does the class reduce anxiety? Yes. And another thing I tell my students never to do in a PowerPoint is do your sources on the last slide, but there they are, because you have different expectations. Yes, sir?
Getting over anxiety is just a result of doing speeches. Maybe we can do away with speech classes and have students do speeches in their content areas.
Oh, we're not a source, we're the cure. Any other question?
All right, let's thank Karl.